Struggling to maintain an erection is a common medical challenge that carries a lot of weight. It helps to look past the frustration and view the process as a straightforward plumbing issue. This system works like a piece of biological hydraulics. To achieve an erection, your body has to coordinate a complex series of pressure changes and fluid movements. The process starts with an inflow. These glowing red tubes, the arteries, must expand to allow a sudden, heavy surge of fluid to rush into the central chamber. Once the fluid is in, the body has to keep it there. These blue tubes are the veins. They act like one-way valves that snap shut to trap the fluid and maintain the necessary pressure. When the system hits a snag, it usually happens in one of two places. On the left, the inflow pipe is too narrow to let enough fluid through. On the right, the valve isn't closing tightly, so the fluid leaks out as fast as it comes in. To find a solution that works, you first have to identify exactly where this hydraulic cycle is breaking down. This is where the Penile Doppler Test comes in. It is essentially a specialized ultrasound that acts like a window, allowing a doctor to see the movement of blood inside those biological pipes. The entire procedure is relatively brief, usually taking about 15 to 20 minutes in a standard clinical setting. Before the test begins, the most important thing you can do is stay calm and relaxed. Your state of mind actually changes the physics of the test. As you see here, a relaxed brain allows blood vessels to stay wide and open, but when you are stressed, your brain sends signals that cause those same vessels to squeeze shut. If those vessels are clamped shut because of nerves, the ultrasound might show a blockage that isn't actually there, leading to a confusing result. Being relaxed is a technical requirement for the test. It ensures the doctor is measuring your physical health rather than your level of anxiety in the moment. The procedure begins with a tiny, specialized injection. This medicine is designed to safely encourage the arteries to open up and allow blood to flow in. While the medicine works, the doctor uses an ultrasound wand to track the internal plumbing as it responds to the stimulus. First, the doctor checks if the inflow pipes widen properly as the vessel stretches. Next, they measure the flow itself, checking for the right speed and volume. Finally, they observe the valves sliding shut, ensuring they hold back pressure with no leaks. If the blood escapes through these valves too quickly, the erection cannot stay firm. This specific issue is known as a venous leak. Finally, the doctor performs a structural check. They look for any physical issues like scar tissue or an unusual curve that might be interfering with the system's architecture. By checking the inflow, the speed, the valves, and the structure, the doctor turns a personal concern into a set of clear, actionable data points. Once the 20 minutes are up, the doctor has a clear map of how your system is performing, which takes the guesswork out of the next steps. This chart compares common findings. Panel 1 shows a healthy balance. Panel 2 shows a restricted inflow, where the pipe is too narrow. Panel 3 shows a leak, where the inflow is strong but the valves can't hold the fluid in. These specific findings help the doctor determine the most effective treatment for you, whether that involves lifestyle changes, medication, injection therapy, or specialized devices. The Doppler test is a standard medical procedure and is considered very safe when performed by a trained professional. Understanding the exact nature of the mechanical problem is the only way to find the right mechanical fix, saving you both time and frustration. Because sexual health is complex, you should avoid self-treating. If you have concerns, consult a qualified urologist or andrologist for a professional evaluation. Taking this step to get a penile Doppler test is a proactive way to take charge of your health and regain your confidence. For more clear, scientific health information, be sure to subscribe to Fresh Vitals. Modern diagnostics provide the clarity you need. When you understand how your body works, you are in the best position to help it heal.